as well.
I move the motion, Cahirlock. And I'm delighted to be able to present this motion today, and I'd like to thank my colleagues in the regional group and particularly Court Niowley for all her hard work. It seems there's not a day goes by in this country where our attention isn't drawn to some area of the health service which is in crisis, and today it's the turn of the dental services. And not just to highlight the problems, but to try and encourage and persuade the government to bring about action which will move and solve the problems. And in June 2021, I brought forward and presented a topical issue related to the Dental Treatment Services Scheme, otherwise known as DTSS. And this was brought about on foot of many constituent patients and dentists coming to me and highlighting the issues that they were facing with the scheme. For the benefit of those who are not aware, the DTSS means that medical card holders are entitled to a free dental examination in each calendar year, as well as any extraction required, along with a number of other services, although limited. In November 2020, it was reported that the number of private dentists participating in this scheme had dropped by 16%, from 16,054 to 13,093 in the 10 months between January and October 2020. It was estimated at the time that around 200,000 medical card holders were facing delays for treatment as a result. Now, to give an example of the practical implications of this, at the time of which were put forward in that topical issue, the number of dentists in the scheme from Wexford and New Ross districts had reduced from 14 to 4. I also questioned Minister Donnelly on the dental treatment scheme on July 12, 2022, and highlighted that a constituent, Sean Hayes, resorted to pulling his own teeth due to a failure to be seen by the dentist, and he had tried 7. In response, Minister Donnelly said, "I've allocated a very significant amount of extra money. The forecast spend for this year would have been about 40 million for this scheme. We have increased that from 40 million to 66 million. Unfortunately, Minister, I later was to discover, and that was thanks to an email I received from the dentist, that in 2009, which is 14 years ago, the spend on adult medical card dental services was 86.8 million. Now, that's some 20 million more than what you had increased the budget for 2022. So, Minister, I wish you'd mentioned that in your response. But the dentists also remarked that the cost in dentistry have increased exponentially since COVID, and this increase will not even cover that. I resigned my DTSS contract in 2020, the dentist went on to tell me, and I am fully booked for the rest of this year. This story is similar with many of my colleagues. The DTSS is outdated in its scope and so burdened with bureaucracy that most dentists like me will never accept another DTSS contract, regardless of what increases in fees are offered. So this motion is calling on the government to review, reform and implement a renewed DTSS, also to increase tax incentives for private patients receiving treatment and much more, and the engagement of all stakeholders. Dentists, first and foremost, need to be consulted about why so many are leaving the scheme. Those people have a greater level of knowledge as to what is actually happening on the ground than the department's administrators, Minister. And once those issues have been identified, then we can go some way towards developing a realistic scheme which is attractive to dentists and will improve outcomes for patients. And we also recognise in the group, as stated in the motion, that the lack of primary school and early dental checkups leads to problems further down the line. Some children are not receiving their first checkups until secondary school age, which, after many essential developmental milestones, such as the arrival of adult teeth, causes problems that are unnecessary and could have been prevented. We are all familiar with the phrase, "a stitch in time saves 9." Unfortunately, when it comes to dental services, there aren't enough stitches being sewn. Looking at the HSE orthodontic services in County Wexford, we currently have one of 2 consultant orthodontists in place, with HSE figures showing that 524 children are awaiting orthodontic treatment, with 93 over 18s awaiting treatment who have been identified as needing treatment before the age of 18. And during a speech on dental services in April 2021, I referenced a letter from a parent which stated that their child was assessed by the HSE orthodontist in Enniscorthy on the 8th of June 2018. The parent was informed that the child would definitely qualify for dental treatment through the HSE, as he is an extreme case, but there is a 4-year waiting list. The parent was extremely shocked by this, but reassured by the orthodontist, as she explained, that this would be the optimal time for the child. The parent rang the orthodontist department during the first lockdown, but the phone was not answered and no one responded to the parent's voicemail. The parent finally managed to get through in April 21 and was told by the secretary that the child would have to wait for another 3 years. That meant that the waiting list had gone from 4 years to 6 years. A couple of weeks prior to that speech of April 21, I wrote to the Minister of State's department and received confirmation that the waiting list was approximately 72 months in duration. And this is the reality for many parents and patients. Oral health care is extremely important and fundamental to our overall health and well-being. Oral diseases are among the most prevalent diseases globally and have serious health and economic burdens, greatly reducing quality of life for those affected, sharing risk factors with chronic diseases such as heart disease, obesity and diabetes. Our dental services are in disarray and need to be tackled head-on with sustained and meaningful action to bring about better and swifter results. This must include a top-to-bottom review and a long-term strategy for improvement, including provide additional training to allow paediatric dental services to operate where a lack of paediatric nursing staff is currently preventing dental surgery under general anaesthetic. Provide additional undergraduate places for dental graduates in Irish universities, provide extra training places for auxiliary workers and a renewed vocational training scheme, improve career paths for auxiliary dental staff, reform the work permit scheme for dentists and nurses, immediately address the uncertainty over the public dental service. These are all necessary actions to bring about improvements, and I hope that the deputies from all parties and none will support the motion. Thank you.